next speaker is Dr. Vardhaman Kankaria. He is Director of Asian Eye Hospital, Pune, a tertiary care super specialty hospital. He is a former secretary of Maharashtra Ophthalmic Society and presently he is secretary of MOS Professional Group Indemnity Insurance Scheme. So he will be speaking on professional indemnity insurance for ophthalmologist, the fine print decoded. So as you all know, we all are having our indemnity insurance since last so many years, but we don't know what is written in that. We just know limit 10 लाख का है, 20 लाख का है, अंदर क्या है, कितने केसेस के लिए देंगे, अपने को क्या कंडीशंस फुलफिल करना है. We don't know anything. बस we just give a check for premium to our agent and it gets renewed, or to our IMA or somebody. So we'll be delving into some fine prints and make us more aware how to go about taking a indemnity insurance. Dr. Vardhaman.
Thank you so much. And first of all, thank you so much, Dr. Viral, for the kind invite. And this is a much required, I think, instruction course. We all know that the patient's tolerance for the outcomes is decreasing day by day. And even for, I think, even when you have a regular cataract surgery done, and if the patient doesn't see 6x6 nowadays, there are patients who actually ask you why I don't see the last line. So you can actually understand to what extent the intolerance for very small changes is also occurring. And now here we are talking about, in the last several excellent talks, if there is a mishap, then of course the patients in today's times are not somebody who are going to leave it alone. They are probably going to pursue it legally, and that is when us as ophthalmologists should be ready in every possible way to face it, and also to continue a practice in the right possible way. So I think the last several talks have been like a preamble to what I'm going to talk to you about. I'm going to keep it very short, and especially also going to focus about what we are doing differently in Maharashtra Ophthalmological Society as well. So professional group indemnity is definitely the need of time. We all know gone are the days when the doctors were given godly treatment and they were given a lot of respect in our society. There was a special status for being a healer, but nowadays whenever you see anybody and there is a community around you, whenever you say that you are a doctor, they always look at you with great suspicion because of the media. And with the advent of Consumer Protection Act, especially, which came in 2019 and 20, the medical practice has become a professional service. Doctors' advice is a commodity now, and patients have become consumers. So in spite of our best efforts, we all are very well trained ophthalmologists and we know how to do a textbook kind of treatment. But even if we do our best scientifically, we take the right decisions for our patient, the patients can still have complications. It is said that a doctor who doesn't operate will be the one who will not get any complications in his life, right? So this is the need of professional indemnity, because it is important for all of us as doctors to secure ourselves with a indemnity cover in the advent of such a legal act by our patient. And the new CPA Act has come into force since July of 2020, and this is something which is unbelievable, because now even at district level, the patient can sue us up to 1 crore of sum or even more, and they can sue us at a court which is anywhere in the country. So even if you are sitting and practicing in Mumbai, and if the patient belongs to Bareilly, the patient can even sue you in Bareilly, and you may have to actually have repeated travels to Bareilly to have this issue sorted. So it is very important to understand this, and in current times the doctors have to run helter-skelter to attend these hearings, and takes a huge toll both mentally and financially, as we all know. So this is like an unfortunate vicious cycle in which this poor mental health, because of this sudden legal battle, that also means that you're not able to do your practice well. It hampers your monetary incomes as well. And this worry about money makes the mental health go even worse. So it's like a vicious cycle that we have a cascading effect. So the purpose of professional indemnity insurance is to safeguard us from professional risks such as legal defense cost, which can be extremely high, exuberant. Nowadays, there are advocates who, in high courts, for example, even to argue for 5 minutes, may charge you for up to 2 to 3 lakh rupees. Claims for compensations, which are going absolutely bizarre, because you must have heard very, very recently that there was a case against radiologist where there was an anomaly scan which could not detect anomaly, and the baby was born with anomalies, and actually the compensation was given in crores of rupees. If there is any injury or there is a damage borne by even the third party, or there is a breach of confidentiality amongst the other reasons. When the patient's expectations of the compensations are significant because of the new CPA Act and the cost associated with litigation is so high, as we discussed, the indemnity insurance protects your finances as doctors and also your mental health. So by investing in this policy, you can ensure that finances are protected. You carry on your business smoothly as usual without suffering from cash flow constraints. And therefore it is mandatory. Okay, so it is mandatory. It is not an option now. It is mandatory for all the members to take professional indemnity scheme. So what is the difference between the individual professional indemnity versus a group indemnity insurance? So all the facilities which are given to the individual and the group remain the same. However, of course, there is going to be a big difference in terms of the premium that you pay. And in some instances, while going for the group indemnity insurance, you can get some extra perks, such as inclusion of, especially in ophthalmology, refractive surgery, the staff can be covered, your hospital can be covered, and also you can have criminal cases which can also be covered, which is never covered in individual professional indemnity. So basically, as we have seen, we have to reduce our indemnity fees and also include the criminal cases. Therefore, it is very important that we need to have a group indemnity scheme. And therefore, in 2020, the Maharashtra Ophthalmological Society, which as we all know is our largest state society of India, has taken this special initiative for our members in the form of MOS PGIO, which is Maharashtra Ophthalmological Society Professional Group Indemnity for Ophthalmologist. So this formation was done as a brainchild of Professor Sunaina Malik, who was the president that time, and Dr. A. Deshpande, who is also the chairman of the legal cell AIOS, MOS, as well as chairman of this new committee. I am the secretary for this committee for 3 years, and the current president, secretary, and the treasurers of that year is also part of the committee members. So what are the benefits that this group indemnity scheme is bringing to our members? Is that there is a marked decrease in the rates. For example, for 1 crore cover, you typically have a premium which goes to 25,000 to 32,000 rupees per year for us. And now that has been reduced to almost 7,200 only by the MOS PGIO, which is more than 75% discount on every year of your premiums. All possible and industry's best coverage. So basically every single thing that you can imagine is covered in this. This is also something that is known to have, I think, big benefit to us is that we have Dr. A. Deshpande as the sound medical legal help. So he's the one who receives this notices and gives you opinion, what exactly is to be done next. And the company which we have involved is one of the market leaders, which is ICSCI. Therefore, it is a single office scenario. It is a single window scenario where all your claims, your settlements, your queries are addressed by one single person. So coverage is also there for your staff, and refractive surgery is also done in the same premium. The defense cost of the lawyer will be borne by insurance company itself, and you may have also a choice to represent by your own choice of lawyer. However, the fees which will be given to your lawyer will be capped because of the they have a capping system in this as well. All these compensations will be given by cashless manner, so you don't have to pay it and then try and get it reimbursed. And even the multiple claim amounts can be paid up to the same assured within that policy time. So in our setup, we have up to 4 such events can be covered in 1 year, which is, I think, very high. And even the out-of-court settlements are also covered in the MOS PGIO, which is hardly done in the individual schemes. So even if you have a patient who sues you in CPA court or even in criminal court, and if the patient says that, okay, I am ready to do out-of-court settlement, but you pay me 3 lakh, 5 lakh rupees as compensation. So that can also be covered in cashless manner by the MOS PGIO group insurance scheme as well. There is a panel of senior doctors as second level consultancy, and they are also going to be helpful in helping you to draft the notices and also in medical legal approach. Cases such as breach of confidentiality and loss of documentation, I think we have just seen that documentation is very important, but even there is a loss of documentation that can also be covered in this policy. But of course, it is always better to have your documentation in place because that goes in your favor in large manner. Cases where there are defamations involved, there is a possibility of dishonesty from the professional. These things are also covered in the MOS PGIO. Importantly, there is no legal fees that our committee charges. And we also do cover COVID-19 related issues in this MOS PGIO. And most importantly, criminal cases which are never taken care of are also taken care in MOS PGI as well. So the premiums, as you can see, are very, very low. For 25 lakhs rupees of coverage, you just require 1850, which is 1850. And I think now it is important that all of us are actually covered for at least a crore of indemnity insurance. So that premium is only 7210, which is extremely low. So this is important for you to know that this has to be renewed every year. It is not a one-time payment. And as Dr. Marathe sir has said, it is important that you renew it before date. Because even if there's a lapse of days and if you have an event during that time, that will not be covered by this policies. So what is the procedure to get such a indemnity insurance? Of course, this is open to currently to only MOS members. So, but we also welcome AIS members who would like to take it by becoming MOS members with our honorary secretary, Dr. Rajesh ji. You can send your forms and we can include you in MOS PGIO, which by the way is the first such group insurance scheme all over India right now. This was inspired by the Gynecological Society's group insurance, but I think the current rates that we are offering are actually more competitive than even what the Gynecological Society is taking. So this can be done even on digital platform. You can send this to Dr. Deshpande sir, to Dr. Sunena Malik, or to me as Secretary MOS PGI, or you can send it to even Dr. Rajesh as the Secretary of MOS currently. So basically, once all the formalities are done, ICSA Lombard will give you the details of the policy. So what if you have a previous policy which is still running? Even if you have a previous policy which is still running, you can still take advantage of this policy. You may have the option of renewing even the previous policy for the time being, because at least for 2 years, sometimes the policies don't cover the previous cases in some formats. In our settings, we are covering right from the day that you deposit the money. Okay, but it is important that the cases are done only after that. So if you have, if you actually become a member in 2022 and if you have a case in 2021, that may not be covered in this policy because of this. But this group policy will definitely protect you in a very big way. So what are the steps to be taken if you get a notice, as I think sir has already told. So once you have taken the policy and if you tend to take a notice, it is very, very important it is essential actually that you involve MOS PGIO committee, and also the, like for example, if you have your own individual policy, you have to inform your company, insurance company, immediately, and you have to make them a party in your case. Because if you don't make them a party in your case right from the beginning, then they are actually not liable to pay a single rupee to you. And there have been cases, multiple cases such as that, where even the Supreme Court and the High Court has gone in favor of insurance companies who actually have failed to compensate the doctors for this. So it is important that you forward them the notice, keep them in the loop at every point line, and you should not lose contact with them, because every update is actually required if you want to take insurance scheme from them. So friends, so as I've said, this was a brief about why you need it and what are the benefits of MOS PGIO. We actually would like, if there are any AS members also, for you to become MOS members and take advantage of this scheme as well. And if there are any questions, we will be very happy. Yeah. So basically, 1:1 ratio means that at one point, only one case can be taken in. But in 1 year, we have 4 cases which can be done through this. Yeah. Yeah. Yes, AIS members from other states can also take advantage of this scheme if you become MOS members. But you will have to become members of the Maharashtra Ophthalmological Society.
Yeah,
you can run 2 policies simultaneously if you want. There are some members from our state who has done that as well. Like AMC also gives policies. So if you want to keep both going, it's fine.
Yeah, sir. Yeah. One thing I just want to ask: if any IAS member wants to become member of this PGIO committee,
not a committee.
No, PGI scheme.
Take help. Yeah.
They need to practice only in Maharashtra, or pan India they can practice anywhere.
No, they can practice anywhere, but in because ICICI will do cover them for all over India. Okay, but so their documentation has to be very, very clear about, I mean, I think all over India, wherever they are practicing, it should be fine.
One more thing, 1:1 he asked. 1:1 means if your policy is of 1 crore and if you are sued for 1 crore, they will give the whole 1 crore. They will do it for 4 times, but the capping will be, in the first case you lose and you are awarded 25 lakhs. Patient has sued you for 1 crore, you are awarded 25 lakhs, he will give 25 lakhs. But again, the second case arises in the same year, you will get 1:1 cover. So 1:1 is the highest and most expensive cover you can get. 1:2 is diluted. So if you get 2 cases, their liability of insurance company will be 50 lakhs only. If you get 1:3, it will be 33 lakhs. So in this scheme, it is 1:4. That means 25 lakhs is the capping if 4 cases arise, and 5th cases they have no liability, the insurance company.
Right. Yes. So we do provide with some legal help also because. Yes. So basically, when we say about legal help is they will be giving you some help and guidelines. Okay, so the lawyers will be appointed by you or with the help of the insurance company. But Dr. A. Deshpande, who is the chairman of our MOS PGI, as well as the legal team of MOS and AIS also, he will help you to basically go through your papers,
Formulate the strategy. He will formulate the strategy.
even guide your lawyer.
Documentation.
So basically, I think as Dr. Marathe sir has said, it is important that I think your lawyer doesn't understand the medical aspects. So when you have a medico-legal expert who is helping the lawyer, will always be beneficial to you. By the company. So basically, if you take the lawyer from them, right? So basically, then of course they have a panel of lawyers, and there is no issues. Yes. ICICI has everywhere in India. That's not a problem. So basically, I mean, what I mean to say is that, for example, if you go for a senior counsel and they charge you 5 lakh rupees for argument, of course the company may not pay it, but with the company you can discuss and you can formulate what they would like to pay you.
Yes, sir. Please.
Somebody gets two different indemnity from two different companies.
Yes. Right.
And if the court, it comes, then that person has to inform both the companies in case it oversees, 15 lakhs.
So actually, like in our medical insurance, in fact, both the companies, you should actually approach only one company from where
You have to inform both the companies. It should be on the record of both the companies that you have been sued, and then you can decide from which company you need to take.
But you can take protection from only one company. So for example, in like cataract surgery, when a patient comes to you, right? So if you have two insurances, he says, I have a 24,000 capping for cataract in one and the 24,000 capping in the other. Can you do cashless in both? But you can't, because you have to actually process the document from only one company. But you should inform to both the companies, but keep only one company in the loop. Yeah.
Sir.
In one hospital, 2-3 doctors are working. So you should take hospital's insurance or all 3 doctors individual.
Both has to be taken, sir. If
Yes.
they are MBBS doctor, both doctor individual as well as hospital. Hospital as a company or as a corporate entity or as a proprietorship, they should have their own insurance, and the hospital doctor may be visiting 4-5 hospitals, so he has to have his own insurance.
Patient can sue both hospital as well as patient.
Absolutely. So there are instances.
Comes to our clinic.
Then if he is insured, then insurance will take cover, but you have got vicarious liability. So for vicarious liability, if you are a hospital owner, you have to take hospital insurance.
So that any doctor comes there, he can operate there.
Yes, but you have to inform the insurance company, so and so is now started visiting your hospital as a consultant, honorary consultant.
So
It
basically
should be on the
nowadays there are
record.
a lot of setups which give access to the other doctors, even for LASIK procedures, for example. So if there is any complication, there is a chance that the patient can sue both the operating doctor and also the hospital where it was operated. So I think, as Dr. Viral said, it is important for hospital to also have it, and doctors who go freelancing. So I think it is important for them to have it, because then they are covered everywhere that they go to. Yeah.
Hospital insurance is very important because your staff is also liable. Your sister, your attendant, your OT attendants, they are all.
So in this scheme, all the staff is also covered. So that is one of the benefits, and refractive surgery is also covered.
Date of filing complaint has a limitation, statute of limitation.
3 years from the date of incidence.
Any case, basic was
Any case, 3 years from the date of
From the
incidence.
patient's point of view.
Sometimes court gives them the extension.
Some leeway is
Sometimes
there,
court gives them the
except but
extension.
that is the exception, not the rule.
LASIK is done in younger patients.
No,
So,
actually,
only after 18 years of age we are doing LASIK. We are not doing below 18.
so I
But
think
if
as
if
said
it's a
correctly,
pediatric case, yeah.
yeah, as said correctly, it is 3 years. But what happens sometime is that it can be extended. For example, if the patient is in your follow-up, for example, you are done surgery, LASIK procedure 3 years ago, and you see the patient after 2 years, and patient develops ectasia, you have seen it, and then he's under your follow-up. So the patient can sue you even later on because he can still say that I was under care that time. So your documentation should be correct. Yeah.
For pediatric patient, it is after he achieves major age 18 years, 3 years from that. So if you have operated 12-year-old boy for cataract, he can sue it up to the age of 21 years till he achieves 21 years because consent was taken from parents. When he becomes an adult, after 3 years, till that time you have to maintain his record for pediatric cases.
Yes.
So I want to ask you a question, not regarding this, it's regarding MMC rules. In continuity of care, a scenario where suppose one surgeon has operated a cataract, maybe that patient has shown you first, you have detected the cataract, he doesn't come to you, he has gone to another surgeon, got the cataract operated, there is some problem. Or there is no problem, just that the surgeon is so busy that he is not able to see him post-op, because you have high-class surgeons who think they only operate and they don't care about the patient post-op. So he says, "अरे उधर तो बहुत गर्दी है, तो मैं नंबर के लिए आपके पास आया." So in this scenario, are you liable to see this patient? As
See, I think as second doctor, you can give the spectacle prescription to the patient, but suppose there is some complication and which was not taken care by the person who has operated, that is problematic.
The question is asking,
question
I am answering. You have the right to refuse patient. You have the right to refuse patient.
No,
If you don't want to see, you have the right just to say politely,
No, in that, as per MMC guideline, it is mentioned there is a continuity of care, and if that patient comes to you, in mandatory, it is required that the operating surgeon or whoever has seen him before has to write a letter of referral saying that, otherwise it amounts to abandonment of the patient.
I think it is like chartered accountants, we need NOC.
No.
In medical profession, there is nothing like NOC.
no,
patient can-
no surgeon is going to write, I am not, I am very
so
busy to see the patient. He's
that's
not
right.
going to, his hospital is there to take care. He
That's
will have some assistants to take
According
care.
to me, if the patient comes to any doctor anywhere in the world, you have to see the patient. You cannot refuse.
But if it is a post-operative patient,
Whatever it may be. Suppose even post-operative it is more
You have right
important.
to
It is more important because suppose there is some complication.
He's
It is an
operated
emergency.
somewhere. He has operated somewhere
still,
else, but
suppose
he's
he's
come for
not
routine care.
so
Suppose
there is a liability of the operating surgeon to see that patient for some period of time. If suppose there is a late end off which can happen in 1 year, if I see him and something happens, he will hold me responsible. So
No,
what
no,
is
no,
the
no.
responsibility of the
no,
operating
say,
surgeon?
whenever
You
you are
will-
checking, it is your diagnosis and that has to be that way comparatively perfect. That does not mean that you are taken liable for that. You can tell the diagnosis. You can tell the patient that this particular care has to be taken henceforth. But according to me, yes, you have to see any patient, whosoever is operating, you cannot refuse the patient. At the most, what you can say, there is some complication. I am referring you to the doctor who has operated. you.
Yes.
That's what you can do. But you don't refuse the patient. That's what I feel.
Seen it late post-op and some complication occurs after 1 year, you are not liable. You are only given medical management. You are not given surgical management. Yes. No, you are not liable, but your documents, whatever you have written will be produced as evidence in the court, and you may be called as a witness or expert. What were your findings when that patient came to you?
Because now I practice in the periphery.
Yes.
So I see a lot of specialist cases as a referral.
Okay.
Because the patient cannot travel, they come to the setup. We
Yes.
see them as a secondary
Yes. Yes.
specialist. So in that case, we would just, like you pointed out, are we responsible as well? For
No, you are not. But then politely you can say that I feel something else which I cannot detect or I cannot treat or I cannot take this treatment forward. I advise you to go there. Suppose it is straight.
mentioning
Yeah. Suppose it is straightforward follow-up.
No, we have
You
to
can
mention
do
on
it.
paper.
No, do we have to mention because we might risk the fellow surgeon as well?
No. You just write down, refer to the operating surgeon or to the for
You
further
need not
management.
mention. There is something what you have to show your original surgeon. Another thing is loose comments is the important thing in medical legal aspects. Don't do loose comment. Whatever you feel like, tell politely that that doctor, that surgeon at that point of time must have thought about your diagnosis like this. Today this is the situation. But don't do any loose comment.